Since opening its doors in 1996, the Texas Tech University Health Sciences Center School of Pharmacy has made it a priority to educate and prepare students for the ever-changing roles of the modern pharmacist. Our faculty and staff are dedicated to arming students with the knowledge, skills, and professionalism that are the keys to success in the evolving landscape of today's professional healthcare field. Whether a student is interested in community or retail pharmacy, institutional pharmacy practice at a hospital or long-term care facility, or conducting pharmaceutical research, our cutting-edge curriculum trains pharmacists who can provide patients with the most effective, compassionate, and up-to-date care possible.
What I've seen over the years is that Texas Tech cares very much about their students. They care very much about the education that they receive, but also about the individual, and that's something that's unique in a professional school.
A strength for the Texas Tech School of Pharmacy is that we have campuses in multiple cities across Texas, in Amarillo, Abilene, Dallas-Fort Worth, and Lubbock. This allows students to pursue their pharmacy education close to home. All students currently must complete their first and second years at either the Amarillo or Abilene campuses. Students can elect to remain in Amarillo or Abilene to complete their third and fourth years, or they may transfer to Dallas-Fort Worth or Lubbock campuses. At all four locations, students benefit from state-of-the-art facilities that include the latest classroom technologies, modern simulation centers, and state-of-the-art laboratories. Texas Tech's pharmacy program consistently ranks among the upper one-third of the nation's accredited colleges and schools of pharmacy and is recognized as one of the very best schools for modern pharmacy education and clinical training. Our graduating classes frequently achieve 100% NAPLEX pass rates on their first attempt, and our NAPLEX pass rate percentages consistently outpace the state national averages. We are nationally recognized for the quality and intensity of our modern pharmacy training, with required rotations in critical areas that other pharmacy schools are only just beginning to include as essential parts of their programs.
So the great thing about Texas Tech is that it utilizes a very extensive experiential program. So it starts students at a very early time in their professional career, starting within the P1 year, working its way all the way through the P4 year, through the introductory pharmacy practice programs and to the advanced pharmacy practice programs. There are many things that our fourth year pharmacy students know that most pharmacy students are getting the introduction to by their fourth year.
In recent years, the numbers of children and elderly patients who require healthcare services has steadily increased. More than 80% of all prescriptions are written for patients in these two population groups, and the needs of these patients will continue to grow in the years ahead.
This type of education really fills a need in the contemporary healthcare marketplace. In a lot of institutions, whether it's pharmacy schools, medical schools, nursing schools, what have you, this type of education would be elective, but here it's required. The largest growing segment of the United States population right now is that over the age of 85. And if the majority of our healthcare workforce is not equipped to meet those demands, we have a crisis on our hands. I'm very proud to say that I work for an institution where all of our graduates will have these skills by the time they're done.
Because each of our campuses are located in cities generally considered to be healthcare hubs for smaller communities where medical and pharmaceutical research